All right, coming up next, Dr. Desai is going to join us live with some tips for parents and kids as they navigate ADHD. ADHD impacts millions of children and adults. It carries a stigma, which sometimes discourages parents from recognizing the symptoms and getting treatment to manage that condition. This morning, Dr. Desai from Kansas City University is here to discuss the signs and treatment for ADHD. Good morning, Dr. Desai.
Good morning, sir. How are you?
Good, good. So what exactly would you say ADHD is? Like the symptoms, how is it different from just maybe a rambunctious or active child?
Yeah, so, all kids and all adults, especially during long Zoom meetings, will have symptoms of it. But the key is that these symptoms have to start before the child turns 12 years of age. They have to last longer than 6 months, and they impair social and academic activities. So, some things that parents should look for, and this happens in 1 in 10 school-age kids in the United States, males more than females, but some things are just having trouble focusing, not being able to pay attention. Then they're always on the go, they might be fidgeting a lot, moving around all the time. And then there's some lack of impulse control. So they often will interrupt or speak without thinking or act without thinking. And again, these are severe enough that they impair a lot of things, and they shouldn't just happen only at school and not at home, or only at home and not at school. Because if it does happen that way, then it's not ADHD.
And what would you say, Dr. Desai? I know this isn't necessarily scientific, but I know sometimes talking to other parents, you'll hear that they feel like it's overprescribed, that young kids are put on prescription medication for ADHD and that they overdo it. And they didn't used to do it in the old days, but nowadays, I don't know if there's anything to that. But what do you make of that criticism?
Yeah, so that's probably a little bit valid because, you have advertising, you have social media. So there's a little bit of heightened awareness. There's a little bit of overprescribing probably that goes on also. So for an accurate diagnosis, you need to interview and have questionnaires completed by not only the parents, but perhaps a child, perhaps a caregiver, perhaps a school teacher, and just doing a thorough evaluation. Then you keep on checking, does the child still need this a couple of years later, and so forth. So you need to do a good job with the assessment to avoid that over-prescribing.
So let's say a family or some parents they're really opposed to going the prescription route. What are some other alternatives, some methods that you can use to treat ADHD in kids?
Yeah, so if you've been accurately diagnosed, then for preschool age children, some things that you can do are behavior therapy. And so this is therapy not only for the child, but the parents go as well, and they try and do a system of rewards, some disciplines, and things like that can help the child. For older children, you probably want to do medication plus behavioral therapy. They tried studying diets, so a lot of people ask about elimination diets, but they haven't really been shown to work for most kids in the research literature. They do work for some subset of kids, but if you're going to do that, you need to talk to your provider. And then, as we say every week, exercise. It helps children with ADHD. It helps children without ADHD. You're aiming for 60 minutes most days of the week. And for those that have ADHD, it can not only help their brain function better, but sometimes makes their medication work better as well.
Very interesting. Good stuff. It is a big topic. Dr. Desai from Kansas City University, thanks for joining us this morning.
And my pleasure. Have a nice week.